Concerning health news on Long Island, where officials are reporting a rise in whooping cough.
This comes right as kids are getting ready to go back to school. Jodi Goldberg has more on the outbreak and who's most at risk of getting severely ill.
A new year and another illness to worry about if you live in Suffolk County. A spike in whooping cough or pertussis cases has led health officials to issue an alert over what they're calling a highly contagious respiratory infection.
It's named after the sound that children make when they cough.
Stony Brook Children's pediatrician Dr. Sharon Nachman says the cases are widespread throughout Suffolk County, and the majority of them are impacting school-age children and their parents.
The recent outbreaks are not at one school district or one location, and that tells us there's more going on.
Doctors say infants, the elderly, and those who are immunocompromised are most at risk. They encourage the vaccine to reduce symptoms. Adults can get boosted every 10 years, and there's a shorter window for children. Testing for diagnosis and antibiotics for treatment also help cut down on the spread.
Of course, many children are not treated, many adults are not treated. We tell families they'll cough for at least a month, perhaps longer.
According to the Suffolk County Department of Health Services, there were at least 108 cases of whooping cough last year in the county, up from 4 in 2022 and 2 in 2021.
The kids feel under the weather, they have fever, they're feeling pretty miserable, they do have headaches.
Dr. Nachman says we're seeing some vaccine hesitancy post-COVID-19 pandemic.
When you get it young and you're early into your age, you do have close to 100% protection. As you age, protection wanes, and you can get either a light illness or the older you get, a more serious illness.
Whooping cough spreads through coughing and sneezing. Doctors suggest washing your hands and staying home if you're sick. Jodi Goldberg, Fox 5 News.